and we now have one of our board members, Melissa. Melissa went over to the ASI conference in the United States, and Melissa's leading some really key work for us. And one of the kind of topics she's going to talk about now is around kind of mental health and independence and what that means. And I think she'll probably touch a little about how she's helping to facilitate, to pull some groups together. We heard from the Italian Association about them having some WhatsApp groups and kind of ways of communicating. So I think some of that will come through from Melissa's discussion too. Okay. Thank you, Melissa.
Great. So I'll just share your slides, Melissa, if you just want to start to unmute
lovely.
yourself. Oh, there you are.
Yeah.
Fabulous.
Sorry.
Right.
And can you guys see me okay?
Yeah.
Perfect. Let me just share the slides. I'll let you know when they're all up and running.
Lovely. Thank you.
That's quite...
I can hear, it sounds like you have.
Okay. Can you all see the slides all right there? Anne, can you see the slides okay?
Yes.
Fabulous. Right. Ready when... Let me know when you want to go on to the next one.
I will do. Thanks, Catherine. So first, I just wanted to say thank you to everyone else who's presented. It's been a really interesting day so far, and a massive thank you to everyone that's organised it. It's been a brilliant day, and long may it continue. So hello to everyone that I've already met. I hope you're all well, and also hello to everyone I haven't met yet. So for those of you who I haven't, as Anne said, my name's Melissa. I have to say that or I can't start properly, so I've started now. As well as being a trustee on the board for ASUK, I'm also a patient with Alström syndrome. I started my Alström journey when I was 26 in 2018, and I got my full Alström diagnosis in 2021. As well as being a trustee on the board for ASUK, I am a qualified social worker, and I've recently qualified as a humanistic therapeutic counsellor or a therapist. And I also work for my local university in our social work department, where I help with some of the teaching, some of the assessments, and putting together documents for greater accessibility for disabled students. So next slide, please, Catherine. So what I'm going to talk to you about today is the importance of mental health. And the first thing that I want to start by saying is sometimes having a mental health conversation or a conversation about mental health can be scary. But evidence does support that having a conversation does not increase somebody having poor mental health. In fact, the opposite. Talking about mental health can really help people, as it helps people feel listened to and gives them a safe space to talk about their feelings. So the first thing that I'm going to share is some statistics about rare disease and mental health from around the world, just to kind of put everything into a bit of context. So in the world at the moment, rare disease is evolving all the time, and there is approximately 8,000 rare diseases. This affects approximately 300 million people worldwide. And that's really a really big one. I read that one, I was shocked by that. So our next slide, please, Catherine. Since the pandemic, especially, mental health has become increasingly significant on the world stage. So I've got this information from the World Health Organization. They have a lot more statistics on their website, and that's something that if you're interested, you can look up in your own time. But they showed that since the pandemic, people's mental health has deteriorated. So approximately at the moment, there is around 28% of people in the world with depression, and this equates to about 246 million people. Anxiety, as I'm sure you can imagine, increased over the pandemic. So 25%, this rose by 25%, and that gives us approximately 374 million people who have anxiety. Suicide was the fourth largest cause of death for 15 to 29-year-olds worldwide. And if you had a disability, you were 10 times more likely to have a mental health concern. So as statistics have shown, anxiety and depression were the leading mental health conditions worldwide. And I've kind of gone over those statistics currently. I'm sure these are statistics that are changing all the time. And to kind of localize it down, this is 1 in 4 people in the United Kingdom will have a mental health condition. But out of that 25%, only 1 person in every 6 will seek support for their mental health condition. So now I'm going to go into our next slide. And people with a rare disease have increasingly complex lives. This could be because of their health condition, their psychological state, and other factors. So here is a collection of causes for depression and anxiety in people living with a rare disease. And this is information collected by Rare Minds. It's a really interesting article. So again, you were free to read that at your leisure. So on this slide, I've got the main causes of depression and anxiety in those with a rare disease or condition. I shouldn't have said 9, because those of you who can't see my slides will be like, what has she missed? So I'm going to just talk through the main ones, and I'm hoping that I catch all 9. So one of them is uncertainty around prognosis and also of diagnosis of a rare condition. So waiting to find out if you have a rare condition or disease, and also then when you find out you have that condition, learning about your life prognosis can be a factor. Unpleasant treatment or the medication can sometimes be a lot to manage, and having the understanding of that medication and the cause of those symptoms and the recovery of, if there is recovery, it was another factor. The development of self and self-identity. So it can be difficult for people with a rare condition to have an identity away from their illness or condition, and can become consumed with medication and that illness. So forming your own identity was an issue for some people. Family structure. Sometimes when you have a rare condition, this can really change your role within the family or how other family members view you. Sometimes you can be viewed as somebody who needs support, who that's what you'll contribute. So a lot of people were worried about how their role in the family would change as a result of their condition. Also, their autonomy and independence on making their own choices and decisions, people worried about. Sometimes they stated that having to take certain medications or limit certain foods was a cause of anxiety. Fears for the future, and I think sometimes really real fears about the future of what's going to happen with your condition. I think in this current climate, especially here in the UK, anxiety around, will I get my medication, as we've got a bit of a medication shortage for certain things. So they are the main. Also being the expert, the patient expert, and having to educate healthcare professionals and other professionals about a rare condition puts increasing strain on a person. Always having to promote awareness, and sometimes working with people who don't understand about some of the health conditions. So they are the main points of what causes anxiety and or depression in people with a rare condition. So next slide, please. So now I want to talk a little bit about the links between good physical health and mental health. So Dr. Brennan completed a survey in 2021 where he concluded that there are significant links between a person's physical health and a person's mental health. He argued that if you have good physical health, you're more likely to have good mental health, and vice versa. If you have poor mental health, you're likely to have poor physical health. So I've got some statistics here that support this. So 1 in 3 people with a long-term health condition will also have a mental health condition. Depression was considered to coexist with conditions such as diabetes, cardiovascular disease, cancer, and arthritis. One of the things that was really important that his study highlighted was if you have a lot of health conditions or you're struggling with your health conditions, and I think it's been flagged in a few of the earlier presentations that actually eating healthy food or wanting to exercise can be affected by your physical health. But actually, again, it's previously been highlighted, when we're eating healthily and when we're accessing regular exercise, it causes the increase of things like serotonin and dopamine, which are hormones that help us feel better about ourselves. So there's a really present link between the two. Also, it was found that people who stated they had positive mental health and well-being were less likely to suffer with strokes or heart attacks, and also those with respiratory problems were more likely to have conditions such as schizophrenia. So there's a real link between how your physical health and your mental health kind of go together. So in response to this, can we I think maybe the next couple of slides, the ASUK one, Catherine, please. So in response to this, I've been working with ASUK, and we really want to explore the links that our patients have with well-being. So we've set up a survey that is looking at patients and families, their sort of response to mental health, how they feel as a person or caring for a person with Alström syndrome. And we're also conducting interviews with a smaller number of those people. So we've decided to do it this way for a number of reasons. So statistics are going to provide us with generalizable, reliable data, which will show us the big trends in what our patients would like to see potentially from a service provided by us. Also, we wanted the interviews and the actual words of our patients to provide us that snapshot and to kind of put meat on the bones of the statistics of exactly how our patients think and feel. And that's really important, that we reflect an authentic picture. So once this study is completed, we're just getting our surveys in now. So we're kind of at the end of one phase. The next steps is conducting those interviews with those people who've identified their interest. And then we'll put that together and see whether our patients would like a service. So when this is completed, it's going to go in the global area of the Alström UK website. So you'll all be able to read the results and see what happens from there. So kind of flowing into this, the next slide, please, Catherine. I'm going to talk a little bit about independence, because I think when we're talking about our mental health, there's those 9 points that Rare Minds have flagged that are factors sometimes in anxiety or depression. But what I thought I would look at, what kind of came through when reading their article in more depth, was one of the big things that causes anxiety and depression is actually the loss of independence or the loss of control that you have with a rare condition. So sometimes this can be with the amounts of medications you can take, with visual impairment, the amount of support you need. And something that's really important to me, and something that I think as well is really important to ASUK and also, Alström around the world, is how we can all have greater independence and autonomy. So what I started by looking at was the actual definition of independence, because I think there's a big stress on us being as independent as possible. So the definition is the freedom from being under control, influence, aid, or support from others. So when I read this definition, it became really clear as to why sometimes people with disabilities have issues with being independent. So for example, I would use sighted guide to get around, or and things like that. So if we're using the dictionary's definition of independence, using that example, I couldn't say I was independent because I'm using support. So I think what's really important for those with a disability or a family caring with someone with a disability is how we use this definition to actually fit our everyday lives. So what I would like you all to do, and I'm not going to ask anybody for individual answers, but what I'd like you to do is think of something you do in your everyday life, be that doing the shopping, cooking a meal, tidying up, or whatever it may be, and think, although you may sometimes do that task on your own, is that a task you can do completely independently without control, influence, aid, or support from any other person? And even say something like shopping, where you go and choose what ingredients you have, it takes somebody else to actually put those ingredients in the shops for you to be able to buy it. So if we look at life under this lens, actually none of us are solely independent. We all rely on aid or support from other people. And I think it's shaping the definition of independence to include these terms that give us the feeling of having more control in our lives. So I think a big way that I define independence is being able to live the life I want in a way that suits me, be that health-wise, personality-wise, physically. It's living that life in a way that suits me. And I've come up with a list of other things as well that will help either you, your child, whoever it may be, with feeling more independent and in control of our lives. Because as we know with Alström syndrome, we don't always have control over that. But I think sometimes if you don't have control over the bigger things, having control over other things gives you a better sense of self, and it can really help give you that security. So two of the things I think help create greater independence is understanding your condition, and also understanding the ways in which you can manage that condition. So I think it's understanding what Alström does in some cases, understanding about things like diabetes and other conditions we may have, and also understanding the point of why we have certain medications. And certainly for me, some of the presentations today really helped home some of those points. Another thing I think as well that gives you more control is actually the patient registry that Kerry touched on a little bit earlier. So I completed the patient registry fairly early on, and actually it gave me one place where all my medications are written down, because they're not always the easiest names. Like I really wish they were called the pink one or the big one, but unfortunately that's not how manufacturers put medication together. So having all of my meds written down in one place that I could go to get all of the names was really helpful, both for me and for doctors that I saw outside of the Alström clinic. And it gave me the control of being able to show that to different doctors. It was a really accessible process. So I could have either completed it on my own using screen reader software, but I was really lucky and had the help of Catherine from ASUK. We filled it in my own time, so you don't have to sit for hours filling it in. It was really manageable, and it gave me a lot of control when dealing with healthcare professionals. Something else that I think helps you feel more independent is also having coping strategies and tips for having good mental health. And that's not to say that every day you'll wake up and you'll feel happy, because we're human, and I think if that happened it would be a bit strange. But it's to teach you that actually not every day will be happy, but that will pass and you will move on and you can flourish and thrive. And some of the things that helped me with this, it was being signposted to organisations and places that could support my mental health, having that safe place with family to talk through how I was thinking and feeling. Having that support's been really crucial. And another element that's been really crucial has been peer support. So I'm going to talk very briefly about the Spencer Tansley report. And this was a report where they surveyed 1,200 people with rare diseases and over 500 caregivers to those with a rare disease. And it really looked at their mental health and also looked at their interactions with healthcare professionals and what these people wanted from the healthcare professionals. So really quickly, 90% of all participants stated that they'd felt anxious, stressed, worried, or depressed about their rare disease or condition. 32% of the individuals with the condition and 19% of carers stated that they'd had suicidal feelings. 88% stated that their healthcare professional had not spoken to them about their mental health. But the 23% that had done stated that actually this had made a really positive difference, and it helped signpost them to places where they could receive support. They'd also been referred to peer support, which was really, really crucial, as this gave them a place where they could be themselves. So this adds to people's concept of self and being their own person. It gave them some really handy tips and advice on how to manage health conditions, and it gave them a sense of belonging. So at Ulster UK, over the pandemic, we set up time to talk sessions. So this was done with people over 18, and we had a chat every month, which we did online. We also created a messenger group so we could keep in touch with each other. In the meantime, we've also created with our children and young people the Culture Family Forum, and this is a group of young people and teenagers, and we meet once a month and we talk about things that are important to them. So not only do we talk about ways for them to be independent, but we also have created a safe space for people to talk about their thoughts and feelings. It's created a really lovely community, and I have to say that I steal tips from people all the time. I'm a great magpie at stealing things that are going to benefit me, and it's come on in leaps and bounds, and it's been a real privilege to see our young people develop over time and become more confident about talking about thoughts, feelings and emotions, as well as those tips for independence. So it's been a really worthwhile group that I hope runs long into the future. So these are some ways that you can promote independence, and we can't always, you know, we might need help to do things sometimes, but if that help is getting us to live the life we want and the life that we want for ourselves, then I actually think it is independent. Another thing that you can do that's going to help create independence and autonomy is to have courageous conversations. So next slide, please, Catherine. A courageous conversation, I suppose, very simply, it's a conversation that's difficult for you to have. And this could be a conversation with a healthcare practitioner, an education provider, someone in the workplace, or it could simply be with friends and family, expressing what you need to flourish and what you need to thrive. So why are courageous conversations important? And I think that they are important because we can all have the same condition, but I think especially with something like Ulster syndrome, it affects each individual in a very unique way. So there's not a one size fits all, and something that might be really helpful for one person might not be for another. So I work a lot with the person-centered approach, which was an approach championed by Carl Rogers back in the 1950s, and it's kind of gained more weight. And that is where you are the expert of your own experience. And I think in situations with people with disabilities, that is certainly the case. So next slide, please, Catherine. So how did this work in practice? So what I did, as I said earlier, is that I work for my local university in our social work department. So I created a document to be given to social work placement providers. So you have to do a placement on the social work degree. And this booklet, it looked at different disabilities and conditions. So I covered physical disabilities, sensory impairments, learning difficulties and differences, mental health conditions, chronic conditions, and also carers. And I also provided a chapter on how best to work with support workers or PAs. So how did I put it together? So I work for what's called the Super Group, which stands for Service User and Carer Participatory Advisory Group. So I created a survey which was distributed amongst the people in the Super Group, and also social workers who I'd worked with in the past that I knew had a condition or impairment. And I asked them questions about what kind of language they'd like to be used to talk about their disability or situation, and also what was best practice and what was worst practice, and then kind of compiled all of those answers into top tips really around each of those categories, and then sent that out to social work placement providers. So this has been a booklet that's also been adopted at the University of York with our other degrees that have a practical element. So the nursing department and also our teaching department have adopted this handbook to learn from themselves, and also to send to their placements to make sure that things are as accessible as possible for students with disabilities. So the next slide, please. The main things that came out of the survey were actually working in a person-centered way is key. So having a conversation with that professional about what works best for you or best for your child was really important. People didn't actually expect everyone to be an expert in everything, and I totally agree with this, because there's so many things out there, you can't possibly be an expert in them all. But they did really appreciate it when people had taken the time to learn about their condition, and they had a little bit more insight and awareness, because this gave them the ability to understand the condition, so that they could then ask that individual what were those things that were going to help them. And the final thing, it made people feel more open and more comfortable speaking about their disability or situation when they saw that their team was promoting equality and tolerance and that openness to listen. Sometimes the people answering were happy to come up with their own solutions, but sometimes when it's at a place, and it might be a place you've never been before or a doctor you've never met before, sometimes you don't know all the solutions. So having that openness to work and find things that work really made people feel independent and that they were having an active role in their own lives. So that really concludes my presentation. But what I would like to say is thank you all so much for listening. And I know we've spoken about having courageous conversations, but I think sometimes it's also being a courageous listener. Sometimes it may be hard hearing to what your child or what your partner or your friend has to say about Alström syndrome. And sometimes those thoughts and feelings might be hard to listen to. So as much as we need to have courageous conversations, we also need to have courageous listeners. So I thank each and every one of you for being a courageous listener today. Thank you.
Fabulous. Thank you, Melissa. Can you hear me okay?
I can perfectly, Anne.
Okay. So it's a little bit of feedback on the chat for you. If I can find it, bear with me, please.
Of course.
Okay. Thank you. So I've completely lost it. Anyway, what it says was, what a fantastic presentation, a great mentor that you are, Melissa, to all of our folks that you're working with Alström, and kind of how impressive some of the work that you are doing and have done is. So, yeah.
Oh, that's lovely. Thank you so much. I really appreciate that feedback.
Okay, now for everybody else who's still listening, we have got some of these topics covered by webinar. They've been some of the most popular. We can send out links to those as well. I think the one thing that struck me, Melissa, listening to you, was really around how others can help enable. So the support stuff, we're all kind of, it's all interlinked, isn't it? But really enabling others, and this peer-to-peer support that comes through from some of the groups you've set up. And I suppose that's a kind of key message, particularly for those other organisations in Italy and the US. I know we're going to hear from Jamie Seeger later, but how powerful that is in terms of peer-to-peer support, talking to other people who really kind of just get it, they get you.
Definitely. And I think that's so important. Not just, I mean, for me personally, it's been, I'm quite new to Alström. So having that peer support has been a godsend for me, because it's given me so many tips. But I think for parents, for siblings, it's nice to have somebody who understands what you're going through without you having to have a massive explanation. And I think there's lots of research and evidence out there that really shows the benefit of peer-to-peer support. And I know we always say, our motto is like stronger together. And I think we definitely are. The more conversations you can have, the better, I think, and the more ways you can express yourself. You're not carrying that inside. So I think it's healthy for us to have as many conversations as possible.
Yeah, absolutely. So I've actually found the I can't believe I've lost it again. Obviously, Yes. So, oh yeah. Okay. So this has come through from the Chief Exec of ASUK, from Kerry. What a great mentor and ambassador you are, Melissa. Another fabulous presentation. Thank you for all that you are and all that you do.
Oh, thank you, Kerry. I really appreciate that.
Okay, so we've also put stuff in there. Marie's put stuff in there about the Culture Family Forum, and we can follow that up with others, you know, after the conference and as we put together the kind of the summaries and the recordings. So thank you, Melissa.
Oh, thank you everyone for listening. Really appreciate it.